Hello, everyone. I'm Casey Kanzler. We're going to be going over week 4 discussion over cognitive behavioral therapy or social learning theory. We're going to come up with a session and implement and design a some sort of cognitive behavioral therapy or social learning theory, and it's going to target specific behavior and a specific offender. Integrate concepts from the reading, explain the sessions and the approach, and be specific. This week I'm going to be discussing cognitive behavioral therapy, and I'm going to design a 35-week intensive cognitive behavioral counseling slash therapy. What's going to happen is we're going to be targeting domestic violence offenders, and we're going to be targeting more the physical violence towards their spouse or children. The first 10 weeks, it's going to be 2 sessions a week. It includes individual therapy with a trained therapist. Um, and this is going to resemble the rational emotive theory therapy, and it includes but is not limited to the role playing, which you can switch roles with family members. The counselor is going to be very upfront with the individual, the offender, and they're going to give it to them straight out. They're going to example modeling, which is basically copying the behavior of the therapist. They're going to be reading self-help books during these sessions, and they're going to go through some sort of anger management training. And by the first 10 weeks, what we want to happen in the individual therapy is we want to get them to where they can talk to others about their issues that they're having, because a lot of domestic violence offenders, they don't feel like they're doing anything wrong. It's their family, it's their spouse. They can do whatever they want with it, but that's not how it's going to work in the 35-week program. It's going to be intensive. It's going to be upfront with these women and men, but we're going to be trying to focus on changing their entire mindset about violence towards their family. The next 25 weeks is going to be a 2 session a week group therapy with trained group counselors, and we're going to be going over stories with others. We're going to try to get them to be outgoing with what they've done in the past, because if you say it out loud, and not just thinking inside your head, it might actually affect them a little bit more on realizing what they're doing to their family. We're going to have some intervention style therapy, which bring their family in, have them, apologize, have their family tell them how it feels. You're going to have role playing, but this is going to be more of role playing and if someone else is hurting their family. Listen to domestic violence survivors. I think this is a good one because some women and children and even men even die from domestic violence, whether it be due to alcohol or just anger management, as a whole. Finally, this is the part that a little bit different than some group therapies. The last couple of sessions that these men and women are going to do, they're going to be teaching the session. The counselor is going to be there, but they're going to step back and they're going to have the new offenders coming into the group therapy. They're going to be answering the questions for them. How did you change? How what has this therapy done for you? And I think that this is going to be the real home run hitter, because once the new guys and gals come in, they're going to see that these people have changed and want to change for themselves. As far as um, that goes, pretty much I tried to keep it organized as far as my outline. I do have a handout that I'm going to be putting on Blackboard, so I mean it's basically what I just went over here, a little bit more detail. Just trying to keep it under 5 minutes. So